Addiction counseling competencies, the knowledge, skills, and attitudes of professional practice. Introduction to Transdisciplinary Foundations. Addiction professionals work in a broad variety of disciplines but share an understanding of the addictive process that goes beyond the narrow confines of any one specialty. Specific proficiencies, skills, levels of involvement with clients, and scope of practice vary widely among specializations. At their base, however, all addiction-focused disciplines are built on four common foundations. The four transdisciplinary foundations are understanding addiction, treatment knowledge, application to practice, and professional readiness. The following knowledge and attitudes are prerequisite to the development of competency in the professional treatment of substance use disorders. Such knowledge and attitudes form the basis of understanding on which discipline-specific proficiencies are built. Understanding addiction, Competency 1. Understand a variety of models and theories of addiction and other problems related to substance use. The knowledge of this are terms and concepts related to theory, ideology, research, and practice. Scientific and theoretical basis of model from medicine, psychiatry, sociology, religious studies, and other disciplines. Criteria and methods for evaluating models and theories. Appropriate applications of models. How to access addiction-related literature from multiple disciplines. The attitudes towards this are open to information that may differ from personally held views. Appreciation of the complexity inherent in understanding addiction. Valuing of diverse concepts, models, and theories. Willingness to form personal concepts through critical thinking. Competency 2. Recognize the social, political, economic, and cultural context within which addiction and substance abuse exists, including risk and resiliency factors that characterize individuals and groups and their living environments. The knowledge of this competency, basic concepts of social, political, economic, and cultural systems and their impact on drug-taking activity. The history of illicit and licit drug use. Research reports and other literature identifying risk and resiliency factors for substance use. Statistical information regarding the incidence of and prevalence of substance use disorders in the general population and major demographic groups. The attitudes of this competency is the recognition of importance and contextual variables, appreciation for differences between and within cultures. Competency 3. Describe the behavioral, psychological, physical health, and social effects of psychoactive substances on the person using and significant others. The knowledge of this competency is fundamental concepts of pharmacological and properties and effects of psychoactive substances, the continuum of drug use such as initiation, intoxication, harmful use, abuse, dependence, withdrawal, craving, relapse, and recovery, behavioral, psychological, social, and health effects of psychoactive substances. The effects of chronic substance use on clients, significant others, and communities within a social, political, cultural, and economic context. The varying course of addiction, the relationship between infectious disease. Competency 4. Recognize the potential for substance use disorders to mimic a variety of medical and mental health conditions and the potential for medical and mental health conditions to coexist with addiction and substance abuse. The knowledge of this competency is normal human growth and development. Symptoms of substance use disorders that are similar to those other medical or mental health conditions and how these disorders interact. The medical and mental health conditions that most commonly exist with addiction and substance use disorders. Methods for differentiating substance use disorders from other medical and mental health conditions. The attitudes towards this competency is willingness to reserve judgment until completion of a thorough clinical evaluation, willingness to work with people who might display and/or have mental health conditions, willingness to refer for treating conditions outside one's expertise, and the appreciation of the contribution of multiple disciplines to the evaluation process. Here we have treatment knowledge of competency 5. Describe the philosophies, practices, policies, and outcomes of the most generally accepted and scientifically supported models of treatment, recovery, relapse prevention, and continuing care for addiction and other substance-related problems. With this knowledge, generally accepted models such as, but not limited to, the pharmacology, therapy, mutual help, and self-help, behavioral self-control training, mental health self-regulating community, psychotherapeutic, relapse prevention, the philosophy, practices, policies, and outcomes of most generally accepted therapeutic models, the alternative therapeutic models that demonstrate. The attitudes toward this competency is acceptance of the validity of a variety of approaches and models, openness to new evidence-based treatment approaches, including pharmacological interventions. Competency 6. Recognize the importance of family, social networks, and community systems in the treatment and recovery process. The knowledge of this competency is the role of family, social networks, and community system as assets or obstacles in treatments and recovery process. Methods for incorporating family and social dynamics in treatment and recovery process. The attitudes towards this competency is appreciation for the significance and complementary nature of various systems in facilitating treatment and recovery. Competency 7 is understanding the importance of research and outcome data and their application in clinical practice. The knowledge of this competency is research methods in the social and behavioral sciences, sources of research literature relevant to the prevention and treatment of addiction, specific research on epidemiology, etiology, and treatment efficacy, benefits and limitations of research. The attitudes toward this competency is the recognition of the importance of scientific research in the delivery of addiction treatment, openness to new information. Competency 9. Understanding the value of a interdisciplinary approach to addiction treatment, knowledge, roles and contributions of multiple disciplines to treatment efficacy. Terms and concepts necessary to communicate effectively across disciplines. The importance of communication with other disciplines. The attitudes towards this competency is a desire to collaborate, respect for the contribution of multiple disciplines to the recovery process, and a commitment to professionalism. Application to practice is here in competency number 10. Understand the establishment diagnostic criteria for substance use disorders and describe treatment modalities and placement criteria within the continuum of care. The knowledge of this competency is to establish diagnostic criteria, including but not limited to current diagnostic and statistical manual of mental health disorders, the DSM standards, and current international classifications of diseases, the ICD standards. Establishment placement criteria developed by various states and professional organizations. Strengths and limitations in various diagnostic and placement criteria, continuum of treatment, services, and activities. The attitude toward this competency is openness to a variety of treatment services based on client need, and recognition of the value of research findings. With this competency, it is described a variety of helping strategies for reducing the negative effects of substance use, abuse, and dependence. The knowledge of this competency is a variety of helping strategies, including but not limited to evaluation methods and tools, stage-appropriate interventions, motivational interviewing, involvement of family and significant others, mutual help and self-help programs, coerced and voluntary care models, brief and longer-term interventions. The attitudes towards this competency is openness to various approaches to recovery. The appreciation that different approaches work for different people. With competency 11, it is tailored toward helping strategies and treatment modalities to the client stage of dependence, change, and recovery. The knowledge of this competency is strategies appropriate to the various stages of dependence, change, and recovery. The attitudes towards competency 11 is the flexibility and choice of treatment modalities, respect for the client's racial, cultural, economic, and social political background. With competency 12, it provides treatment services appropriate to the personal and cultural identity and language of the client. The knowledge of this competency is various cultural norms, values, beliefs, and behaviors, cultural differences in verbal and nonverbal communication, resources to development individualized treatment plans. The attitudes are respect for the individual's differences within cultures, respect for the differences between cultures. With competency 13, adapt practice to the range of treatment setting and modalities. The knowledge of this competency is the strength and the limitations of available treatment settings and modalities, how to make access and make referrals to available treatment settings and modalities. The attitudes towards this competency is a flexibility and creativity in practice application. Competency 14 is being familiar with medical and pharmacological resources in treatment of substance use disorders. The knowledge of this competency is current literature regarding medical and pharmacological interventions, assets and liabilities of medical and pharmacological interventions, health practitioners in the community who are knowledgeable about addiction and addiction treatment, the role that medical problems and complications can play in the intervention and treatment of addiction. The attitudes towards this competency is open and flexible with respect to the potential risks and benefits of pharmacotherapies to the treatment and recovery process. In Competency 15, we are to understand the variety of insurance and health maintenance options available to the importance of helping clients access those benefits. The knowledge of this competency is existing public and private payment plans, including treatment orientation and coverage options, method for gaining access to available payment plans, policies and procedures used by available payment plans, key personal roles and positions within plans used by the client population. Attitudes towards this competency is willingness to cooperate with payment providers, willingness to explore treatment alternatives, and the interest in promoting the most cost-effective and high-quality care for the client. In Competency 16, we recognize that crisis may indicate an underlying substance use disorder and may be a window of opportunity for change. The knowledge of this competency, the features of crisis, which may include but are not limited to family disruption, social and legal consequences, physical and physiological, panic states, physical dysfunction, substance use screening and assessment methods, prevention and intervention principles and methods, principles of crisis care management, post-traumatic stress characteristics, critical incident debriefing methods, available resources for assistance in the management of crisis situations. The attitude towards this competency is the willingness to respond and follow through in crisis situations, willingness to consult when necessary. Understand the need for the use of methods for measuring treatment outcome. The knowledge towards this competency is the treatment outcome research literature, scientific process, and applied research. Appropriate measures of outcome, methods for measuring the multiple variables of treatment outcome. The attitude towards this competency is recognition of the importance of collecting and reporting on outcome data, interest in integrating research findings into ongoing treatment design. Competency 18 discusses professional readiness. Understanding diverse cultures and incorporate the relevant needs of culturally diverse groups, as well as people with disabilities, into clinical practice. The knowledge of this competency is information and resources regarding racial and ethnic cultures, lifestyles, gender, and age, as well as relevant needs of people with disabilities. The unique influence the client's culture, lifestyle, gender, and other relevant factors may have on behavior. The relationship between substance use and diverse cultures, values, and lifestyle. Assessment and intervention methods that are appropriate to culture and gender. Counseling methods relevant to needs of culturally diverse groups and people with disabilities. The Americans with Disabilities Act and other legislation related to human, civil, and clients' rights. The attitudes towards this competency is willing to explore and identify one's own cultural values, acceptance of other culture values as valid for other individuals. With Competency 19, understand the importance of self-awareness in one's personal, professional, and cultural life. The knowledge of this competency is personal and professional strengths and limitations, cultural, ethnic, and gender biases. The attitudes towards this competency is openness to constructive supervision, willingness to grow and change personally and professionally. With Competency 20 is understand addiction professional obligations to adhere to ethical and behavioral standards of conduct in the helping relationship. The knowledge of this competency, the features of crisis which may include but are not limited to family disruption, social and legal consequences, physical and physiological panic states, physical dysfunction, substance use screening and assessment methods, intervention principles and methods, principles of crisis case management, post-traumatic stress characteristics, critical incident debriefing methods, available resources for assistance in the management of crisis situations. The attitudes towards this competency is willingness to conduct oneself in accordance with the highest ethical standards and willingness to comply with the regulatory and professional expectations. In Competency 21, we understand the importance of ongoing supervision and continuing education in the delivery of client services. The knowledge towards this competency benefits the self-assessment and clinical supervision to professional growth and development. The value of consultation to enhance personal and professional growth. Resources available for continuing education. Supervision principles and methods. The attitudes towards this competency is committing to continuing professional education, willingness to engage in a supervisory relationship. In Competency 22, we understand the obligation of addiction professionals to participate in prevention and treatment activities. The knowledge towards this competency is research-based prevention models and strategies, the relationship between prevention and treatment, environmental strategies and prevention campaigns, benefits of working with community coalitions. The attitudes towards this competency is appreciation of the inherent value of prevention and the openness to research-based prevention strategies. With Competency 23, we understand and apply setting specific policies and procedures for handling crisis or dangerous situations, including safety measures for clients and staff. The knowledge towards this competency is setting specific policies and procedures. What constitutes a crisis or danger to the client and or others? The range of appropriate responses to crisis or dangerous situations, universal precautions, legal implications of crisis response, expectations to confidentiality rules in the crisis or dangerous situations. The attitude towards this competency is understanding of the potential seriousness of crisis situations, awareness for the need for caution and self-control in the face of a crisis or danger, the willingness to request help in potentially dangerous situations.